Hi, welcome everybody. Thank you for joining us today for this webinar, which is jointly hosted by USAID and Grand Challenges Canada. My name is Ken Simiyu, an innovation advisor at the Center for Innovation and Impact at USAID. I will be the moderator for today's session. In today's session, we will be exploring the findings of a report titled Unlocking Africa's Health Innovation Potential, Navigating the Investment Readiness Programs in Africa for Health. This report was commissioned by USAID and Grand Challenges Canada to gain a deeper understanding of the investment readiness landscape in Africa. We will have a presentation of the report by Open Capital Associates, who led this initiative on behalf of USAID and Grand Challenges Canada, followed by a presentation by an esteemed panel of a group of panelists who are experts in this area. And there is, you can see the brief agenda. Before we proceed, I would like to say that the opinions that will be provided or given during this session are personal opinion and do not in any way reflect the official position of either USAID or Grand Challenges Canada. Now, just as we proceed, or as you people keep joining, if you can, please type in the chat where you are calling from and perhaps a brief introduction of yourself so that others can know you. It's also a part of a networking session. And then as we keep proceeding, if you have any burning questions, just put them in the chat and we will proceed and answer them at the appropriate time. So before we proceed, let me just hand over to the Deputy Director of USAID, Mila, to give us, the Deputy Director of CII at USAID, Mila, to give us a few opening remarks. And then from there, we will proceed to Liat, from the Director of Social Finance at Grand Challenges Canada. So over to you, Mila. Thank you.
Thank you, Ken. Good morning, good afternoon, everybody. I'm delighted to open this webinar and make some introductory remarks. So as Ken said, my name is Mila Nipomishe. I'm Deputy Director with the Center for Innovation Impact. And I just want to make some comments to set the scene about why we're here, why we care about this topic. So for one, our team, we are in the Global Health Bureau at the U.S. Agency for International Development. And our role is to accelerate sustainable health impact through digital transformation, financial innovation, and market-based approaches. We support the Bureau's engagement with the private sector because we firmly believe that intentional strategic engagement to unlock resources, both expertise as well as financial, from the private sector can advance our ability to achieve our goals. These are preventing child and maternal mortality, controlling the HIV epidemic, and combating infectious diseases. Time and time and again, we've seen that the private sector matters, particularly in sub-Saharan Africa. In many countries, over half of healthcare spending is in the private sector, particularly in places where the state has low capacity to provide essential care. And we're also aware, I think most of us are hopefully aware about the annual funding gap for health sustainable development goals in low and middle income countries. We've seen that gap over and over, and now we're going to see it again leading up to 2050. We are in an era of a decline in official development assistance, and so the role of capital markets, which is somewhere upwards of 200 trillion, dwarfs all other sources of financing. So we need to figure out how to tap into that. As one of the largest development funders for health, we believe that we have to engage with investors of various types and bring them on board to help us achieve our health impact goals. And so through our own work, our team engages directly with the Development Finance Corporation, and we find different ways to support innovators. We believe that both health and financial priorities can actually be mutually beneficial. And in fact, we see more and more investors interested in social impact investing with an explicit dual bottom line for return and impact. So what we're trying to do at CII is build the confidence, both internally within the Global Health Bureau about this approach, as well as build confidence among investors to engage in health priorities that matter to us. But financial commitments for health enterprises is not enough. More money is not enough. And through our work, we've seen very few health businesses or innovations reach a point of what we call minimum commercial viability. And so I think, again, we're all too familiar perhaps with the value of death or the missing middle, where there's a lot of grant money for small pilots and testing and proofs of concept. And then there's, on the other side, Series A, B, et cetera, venture capital. And in the middle, what is there? And so we see a big mismatch in funding between what health enterprises need and what is available. And so we're on a mission to reduce that mismatch. So we need more than just funds. We need partnership curation. We need brokerage between different types of financing and innovators, as well as support to investors to better understand what is possible and build that confidence. And if we as development partners don't lean in with our own sweat and equity, it's going to take far too long to address the financing gap, or we might not actually do so. So this is why we're very excited to partner with Grand Challenges Canada on the endeavor you're going to learn more about today, diving into investment readiness programs in Africa. This is an ecosystem play for us, and it's given us a much stronger understanding about what can be done to attract more investment in health enterprises on the continent. From a USAID perspective, I also want to emphasize that we believe that local actors are best positioned to design and scale solutions to local challenges. And so this is very much for us at the heart of our localization agenda. And for us at CII, it's a great example of how our team can further that. So coming out of this, we hope to partner with Grand Challenges Canada and others on how to support different kinds of investment readiness programs locally, and by extension, the health innovators, local health innovators that can bridge the divide between investment and innovation. So thank you for being here. Thank you for listening and engaging. We expect this report to catalyze more support for this agenda. This is the start of a conversation. We're very open to exploring what different kind of support could look like. We don't have a clear action plan. There won't be big announcements here. This webinar is intended to be a source of input for us as we think about what to prioritize moving forward. So with that, please review the content. I'm excited about the panel to come. Don't hesitate to reach out to Ken and our team with further ideas, questions, and opportunities for engagement. And so just to thank my colleague Ken Simu, who's really led this from the CII side, alongside Liat Gellis from GCC, with very close collaboration from Mara Hansen-Stables of Salient Advisory, Lawrence Kovold and his team at Open Capital Associates, and Kay and her team from Rios Partners. And with that, back to you, Ken. Thank you.
Thanks, Mila. So I now hand over to Liat Gellis, who's the Director of Social Finance at Grand Challenges Canada. Liat?
Thank you, Ken. I'm so pleased to be joining everyone here today. As many of you know, Grand Challenges Canada, our mission is to build a healthier, more equitable world by supporting local, scalable, and sustainable innovations. And so we're really thrilled to be partnering with USAID and Open Capital and Salient in producing this report that we'll be sharing with you today. We have supported over 1,500 innovations in over 100 countries with support from the Government of Canada and other partners, and over half of which implement in sub-Saharan Africa. And something that we're also really proud of is that over 2/3 of the innovations Grand Challenges Canada supported are led by locally led enterprises, which is why we are also really keen on deepening locally led supports for our portfolio of innovations, like those featured here today in this webinar and reflected in the report. And it is why we truly find the information and the insights revealed in this report so important and relevant to the work we do. And we hope others will be inspired as well. Over the years, we've partnered numerous times with the team at USAID Center for Innovation Impact, and we couldn't be more delighted to be working together again alongside Open Capital and Salient, as I mentioned. And I truly commend the entire team's leadership and dedication to this work. I will keep my comments brief, largely because I would echo all the sentiments Mila just shared, and I don't want to hold us up any longer to hear from Lawrence from Open Capital and our esteemed group of panelists. So with that, I will throw it back to my old colleague and my good friend, Ken. Back to you.
Thanks, Liat, for that presentation. And just before I call on Lawrence, Just a reminder for those who have just joined, please, if you can, just introduce yourself briefly in the chat and the organization you are calling from, so that it's part of our networking session. At the same time, if you have any questions as Lawrence goes through his presentation, or the panelists, please put them in the chat and then we will address them at the appropriate time. So at this juncture, let me hand over to Lawrence Caulfield, who largely led this report on behalf of Open Capital. Lawrence, over to you.
Yes, thank you, Ken, Liat, Mila, for these introductory remarks, and hi, everybody. Also, thank you for giving me the opportunity to present some of the key findings of the report to this great audience today. So my name is Lawrence Caulfield. I'm a principal at Open Capital Advisors based out of our Kenya office, and I've led this initiative last year. So let's go into the content. In my presentation, I will start with a short introduction, then go into the findings from our landscape analysis, in which we looked at 87 investment readiness programs, or IRPs, active in Africa. We will then look at some of the factors that drive the effectiveness of those IRPs in helping companies actually raise investment, and then share more on the opportunities that you can also find in the report. I realize I will go somewhat quickly through these findings in the presentation today, so please read the report if you want to know more details. So how to support health innovation by the private sector in Africa? I think that was the question that Mila was raising or alluded to bridge the funding gap and to support the missing middle. Now, many studies show that the lack of access to capital is one of the biggest obstacles for growth of African businesses. And at the same time, investors indicate that there's more capital available than being deployed. So, and one of the problems is that there's a lack of pipeline of investment-ready businesses. And now the health sector specifically attracts limited investments. I think illustratively on the left side of this slide, you see that only 4% of the equity investments in Africa had gone to health in 2022. Some of the factors contributing to this are that health innovation requires more product development, or R&D, is faced with more regulatory hurdles, such as to approve products, and that other sectors are simply more appealing because they have greater deal flow and exit opportunities. Now, investment readiness programs are one solution to help improve the investment readiness of the private sector, and USAID and GCC wanted to know more about those IRPs in Africa. Yes, so, sorry, this goes too quick. So given that little is known about the landscape of IRPs, the study was launched and we looked at understanding the landscape of IRPs in terms of how many can we find, where are they based, what do they focus on, what are their results, and what are the factors that contribute to their success. And then secondly, to then identify opportunities for intervention. For those of you who do not know Open Capital Advisors is a management consulting and financial advisory firm focused on Africa. So we have more than 170 staff based out of 7 offices, and we bring deep local market understanding and a strong focus on investment raising across the continent. In this sorry, this goes too quick. In this presentation, we followed a 5-step process, starting with extensive desk research, looking at 87 IRPs, using public data on their approach and results. And this analysis was then complemented by 25 consultations with African businesses, with investors, with IRPs and funders, which enabled validation of some of our findings and a deeper understanding of the challenges and opportunities. In our presentation, in our analysis of the support models of IRPs, we used a segmentation into 3 main archetypes. And note that these are archetypes, but in reality, there's a lot of mix and there's a spectrum of different models that we have seen. So the first one is accelerators, I think well known, often work with businesses in cohorts. over a period of, say, 3 to 9 months, and they have typically less of a focus on capital raise compared to the other two types. The second archetype we've called pure play IRPs, just because they are programs that are really geared towards investment raising, and those have a one-on-one support model, and typically those are programs of, say, 3 to 5 years. And then the third archetype is what we call venture studios or venture builders, which are organizations that build businesses from scratch and often in-house. So the support to businesses covers multiple years, and there's often an element of capital that these venture studios can also provide to businesses. Okay, now looking at the landscape, we can see that accelerators are the most prevalent type of IRPs because this model has been around for longer and is also more easy to set up and replicate. The two other models, pure play IRPs and venture builders, have been emerging more recently, and both have a more heavy focus on tailored support and investment raising, as I already mentioned. We also looked at where IRPs are based and what regions they cover, as in some of those IRPs support companies in a range of countries outside of where they're based. So there are obviously a number of programs that are headquartered outside of Africa that focus on Africa, but for those that are based in Africa, you can see most of the IRPs are headquartered in East Africa and West Africa. And you then, if you zoom in, you then see that they are mostly based in the kind of big 4 countries, or the countries that also see the greater investment volumes, being, for example, Nigeria and Kenya. And the large majority of IRPs actually support companies across countries or regions, beyond the country that are headquartered, just to spread portfolio risk and to see a bigger potential pipeline. In terms of sector focus, the report shows that a significant number of IRPs include health as a sector, but few specialize in it. It is maybe worth noting that the data may be skewed just because we made an effort to find IRPs active in health, but this is the findings that we had. And as I already mentioned, IRPs often adopt a broader scope, both in sectors but also in countries, to allow for a broader portfolio and spreading of risk. Of those IRPs that cover health as one of the sectors, most of them focus on health tech companies, as those are typically more scalable and investable. And we found 9 IRPs that focus exclusively on health. So of the 9 are presented on this slide, most of them having been launched since 2020, potentially driven by the interest in health due to the pandemic that year. And this table is also in the report. You can see some of the results of these IRPs in terms of number of companies supported and capital raised by those companies supported. And I'm happy to see that Wilfred from Wilbur Africa is on the panel today to share their experience. Then we also looked at when IRPs were founded and how many companies they supported more broadly. On the left side, you can see that a large amount of IRPs are relatively young. And actually, when you zoom in, then most venture studios have emerged in the last 5 years. And then on the right-hand side, it's maybe a difficult table, but it's essentially saying, given that accelerators have existed longer and typically support cohorts, groups of companies for a shorter time, you also see that they support generally a bigger amount of companies, like 100 plus or 150 plus companies. Now, to say something about the success of IRPs, we have looked at outcomes achieved, and obviously one of those outcomes is the amount of capital raised by the companies supported by the IRP. I think one of the key findings in the study is that 2/3 of the IRPs, despite their focus on investment readiness, do not publicly disclose this information. And when we spoke to several stakeholders, they said, well, it could partly be due by the fact that this metric is just very difficult to achieve, as capital raises take long and businesses may face many obstacles. Other success indicators reported by IRPs are mixed, and so it makes it difficult to assess success or compare them. Now, the graph on the left on this slide shows that for the 29 IRPs that do report capital raise, that 13 of them have raised less than $20 million, in total, and 13 of them have raised more than $100 million in total. But that last group does include some of the global IRPs for which we could not find the Africa-specific data. The next element we looked at was the impact focus of IRPs, so particularly whether they have an explicit focus on women, given the gender gap that is present in Africa and the trends on gender lens investing. And a study found that 22 of the IRPs explicitly state a focus on women. But I have to say that, as highlighted earlier, IRPs often adopt a broad scope in terms of countries, sectors, but also in terms of impact to allow for a larger potential pipeline. Now, lastly, for the landscape analysis, we looked at how IRPs are typically funded. And I think globally, in our experience, and evidence shows that it's very difficult for accelerators and venture builders to generate enough income to fully sustain themselves. So some exceptions exist, like Y Combinator, who are self-funded through the fees that companies pay and the returns that Y Combinator gets from selling equity positions in their portfolio companies. But for Africa, in our experience, it's not feasible in the near term for IPs to sustain themselves without a continued need for grant funding. And now across the archetypes, we found that accelerators have a more diverse mix of funding, but all IRPs either fully or predominantly rely on grant funding, and we expect this will continue. So that's for the results for the landscape analysis. Then, besides the landscape analysis, we also looked at some of the key success factors for IRPs. Based on our experience and based on desk research, this slide highlights some of those factors. So going from left to right, obviously it starts with selecting the right businesses to support through a tailored intake process and robust screening. Then the business support itself is ideally localized and tailored and also long-term to drive investment success. And then key is as well to have an element of transaction support embedded with strong investor engagement and investment-focused KPIs, and ideally some level of investment capital available within the IRP, as I mentioned before, which helps to de-risk investors. Now, at the bottom, in terms of organizational setup for the IRP, it is obviously key to have the right skills and team in place, to have a solid investor network, and also sufficient and longer-term funding to deliver services. Now, in our analysis, as I said, we spoke with a range of stakeholders where we tried to dig deeper into success factors for health. And many of the factors from the previous slide are obviously valid also for health. And we've detailed these factors on this slide also in the report into two categories, operational and ecosystem. And on the left-hand side, tailored support, again, is more likely to be effective in raising capital, particularly in the more complex health sector. Again, longer-term support, say more than a year, is helpful to get to capital raise, just as it takes time. Then many IRPs are generalists in terms of skills and broad in scope, as I mentioned. However, the health sector requires specific expertise, which seems important to success as well. A lot of IRPs, as I mentioned, are serving or covering multiple countries that they're not headquartered in. And consultations indicate that IRPs require some form of local expertise or knowledge, especially in healthcare, for example, to understand the local care options and the healthcare system. I already mentioned the embedded capital can be significantly increase the chances for health innovators to attract a next round of finance. And the funding of IRPs is often not tied to the results in raising capital. And IRPs that do have such incentives in some or other way, like venture studios, are likely more successful in raising capital. Now, the success of IRPs is also influenced by several ecosystem factors, of course, many of which are the same factors that also drive investor interest. So macroeconomic factors like market size or political stability or doing business factors. So all of these are very important to tackle and explains why certain countries have a lot more attention than others. But in our study, in this review, we focused on two primary areas identified in consultations where interviewees or the people we spoke to felt that donors could enable IRP effectiveness without broader structural reforms. So one is on the investor side. As we saw, there's less early stage capital available for healthcare businesses compared to other sectors. And in part, some investors said this is often this is due to lack of information on healthcare opportunities and a lack of understanding of regulatory environments or risks. So joint efforts could be helpful to crowd in more investors into health, and I will come back to this a bit later. On the government side, innovators and investors are faced with many regulatory challenges, such as those related to approval of health products or regulations for online pharmacies and telemedicine businesses. So while solutions are needed, as I said, this involves big reforms. Consultations also noted the important role of governments as enablers of IRPs, such as promoting it or being a purchaser of health products or a convener for businesses and investors. Now, I realize I spent a bit more time on this slide, but it also leads up to the opportunities we identified in the report. So let's go there. So based on the landscape analysis and the consultations, we prioritize several intervention areas that would best allow donors to fund IRPs to drive investment into health. And these interventions include direct support to IRPs and ecosystem interventions, both being critical. So this first slide has the two IRP-related interventions. So we found that only 10% of the IRPs focus on health, and only 1/3 of IRPs publicly share capital raise outcomes. We also found that specific health expertise is important, and that incentives on capital raise can be important. So the first opportunity is a fairly straightforward one, is to allocate funding to health-focused IRPs or to IRPs that are then encouraged to set up a health program and then to require reporting on capital raise outcomes to measure success. The second, for the second, we have seen that the dominant and traditional accelerators have been criticized for providing a bit too general and or too short-term support. And venture studios, on the other hand, offer a very different approach, providing deep support and risk sharing. And these models are emerging and still somewhat unproven, but both businesses and investors consulted believe that these could be more effective, especially in industries like healthcare. So the second intervention would be to specifically provide funding to venture studios to test this model further. And this could be a healthcare-focused venture studio in more established markets like Kenya or Nigeria. And it could also be a venture studio that covers health as one of the sectors in smaller markets like Francophone West Africa or Senegal. And I'm happy to see that Haske Ventures from Senegal is in the panel today to share more on that. And the last slide for me. So the two last opportunity areas are these. I shared that there's less early stage capital available for healthcare businesses and investors, and it can be due to a lack of information on opportunities. So the idea here would be to support industry associations or investor networks to launch healthcare focused activities such as pitch events or investor visits or information portals, like the AVPA is doing. And consultations noted that this could be particularly helpful for a region like Francophone West Africa, which we looked at in a bit more detail in the report, where you just see fewer investors engaged and there's a higher cost to access information for them. And then lastly, many businesses and IPs commented on the importance of government, I already mentioned, to clarify regulations or to convene stakeholders, but governments often lack capacity to identify where to engage and take action. And donors could identify willing governments in certain countries and hire experts that are embedded to identify specific areas where government action would enable the local healthcare ecosystem to thrive. So through regulation or industry convenings or joint investor attraction. And we realize this opportunity is very context specific and very challenging to implement, but also cannot be ignored given the important role played by governments in IRPs, but also in the health sector specifically. So this is where I think I stop my presentation and give back the floor to Ken. Thank you.
Thanks, Lawrence, for that great presentation on the findings of the report on investment readiness programs in Africa. This report offers some valuable insights into the role of these programs in shaping the future of African startups and their ability to attract investors. Now, if you have any burning questions, please put them in the chat or Q&A. We will address them towards the end of after the panelists have spoken. And also for those who have just joined, please introduce yourself in the chat so that others can know you as part of networking. Now, we will now proceed with a panel discussion where we'll be diving into the implications of this report. Our panelists today offer a diverse set of perspectives from an investor, an IRP, a venture studio, and an entrepreneur. Together, we'll unpack the report's findings, discuss its implications, and explore how investment readiness programs can continue to support innovations and entrepreneurship across the continent. I'll start by making a quick introduction of the four panelists. The first panelist is Naum Monari Magero. Naum Monari, sorry, is an innovator and founder of Benacare, a company focused on healthcare in Kenya and has first-hand knowledge and experience with investment readiness programs and investment fundraising. Naum is the founder and CEO of Benacare, building a movement of thousands of healthcare workers to disrupt systems perpetuating extreme poverty in Kenya and beyond. After starting as a student nurse, Naum embarked on a transformative journey to redefine healthcare accessibility in Kenya. Naum won the WorldSilts Global Citizen Disruption Award in 2022 and was recognized as Westerwell Young Founder and of the Year in 2021. We'll know more about Benacare when I invite Naum to speak. The next panelist is Wilfred Jagi, the co-founder and CEO of Vilgrow Kenya, which is an IRP. Wilfred is the co-founder of the Vilgrow with extensive experience across the Middle East, India, and East Africa. Wilfred is deeply involved in the African entrepreneurial ecosystem as an incubator lead, angel investor, and transaction advisor. After a stint at the African Venture Capital Association, he joined Vilgrow in India as a fellow before scaling the organization to Africa. Wilfred has reviewed over 200 entrepreneurial pitches and mentored over 100 startups. Then the next panelist is Maji Sok, the co-founder and CEO of Husk Ventures, which is based in Senegal. Maji has 26 years experience managing projects across Africa, Asia, and Eastern Europe and USA. She specializes in strategic design and planning, particularly in health. She is currently leading the partnership between Husk Group and Institut Pasteur de Dakar to launch health ventures such as AI-driven health triage. She also directed Senegal's 2022-2023 research and innovation strategy and oversees Husk's partnerships with IDRC to fund R&D startups in Africa. Then the last panelist is Seu Steve Tawia, who is the managing partner of Jaza Rift Investor. Steve, Jaza Rift Investor is a 50 million seed stage VC fund focused on digital health, medtech, biotech, and assistive tech across Africa and the Middle East. With 25 years of experience in investments, angel investing, venture capital, and private equity, he has a vast network spanning Europe, UK, Africa, and the Middle East. Seu Steve is a strategic advisor to public and private organizations. He's a public speaker and an advocate for Africa's opportunities. Thank you all for being here. So I'll just quickly dive into the panel. and it will be a Q&A to the panel. And then, as a reminder, just put your questions to the panelists in the chat or in the Q&A. Now, I will start with you, so Steve. As an investor, the report makes findings that many IRPs are not able to ensure that their hosted companies are successful in attracting investor funding for health. Why do you think this is so? But perhaps you'll just start by giving us a little bit pitch on what JAZARIFT is all about. Thank you.
Thank you very much, Ken, and I hope you can hear me well. Again, thank you for having me here. What I'll say is that JAZARIFT, as the name says, JAZA is to fill Rift Valley gap of investment in healthcare. And really, our objective is to bridge that gap in partnership with the different stakeholders, especially Regular Africa here, to really be a conveyor belt between innovation in the incubation and acceleration and really bringing those innovations to market. And as the report says, we realized that gap in the pre-seed, seed, and Series A. That's why our fund is really targeting that spectrum where we realize there's an investment gap in healthcare on the continent. One of the areas where I think IRPs generally, and I think it's valid for agriculture in the past where I was, they do not have fundraising target beyond what they do. And I think it's very important for healthcare to have those targets to really drive a clear result at the end of those kind of programs. And, you know, I've had the opportunity to run RBFs, result-based financing, that really changed perspective in agriculture. Maybe healthcare could also benefit from that. But what I would say and notice broadly, as the report says, there's no KPI or log frame or however you want to call it that drives that kind of numbers unless you set it out for yourself, as for instance Vilgro has done and now raising about 19 million for its portfolio companies. So to answer your question, JAZA is really there to bridge that gap, and the existing structures are not targeted at raising additional capital, and that could be the help of this forum to really add that kind of target as a KPI to IRPs.
Thank you, Steve. And just a quick follow-up question. The report mentions that early stage investors do not really focus on health. So what advice would you give to early stage investors who want to focus on health? Or do you, first of all, do you agree with that? And what advice would you give?
Absolutely. I mean, it's so essentially what it means is that we need to educate the ecosystem more about the healthcare investment opportunity and bridge the asymmetry of information so that investors who are interested can understand the sector more and then invest in it more. We are co-organizers of an event called the Transforming African MedTech Conference in Nairobi, end of August. We did the second edition. Something that came up consistently is that other investors reach out to us, Vilgro, JAZARIFT, to ask us opinion about investment opportunities in healthcare because they feel that internally they don't have the capacity to do so. So we kind of serve as a proof point, a reassurance for them to say, look, if Vilgro, JAZARIFT, or people who know healthcare are willing to invest, maybe we can tag along, maybe we get more experience and knowledge. So to answer your question, broader education about the healthcare investment opportunity on the continent is very critical to educate LPs, fund managers, and their teams on the healthcare investment opportunity.
Thank you, Steve, and we'll come back later. But let me turn to Wilfred for a moment. And Wilfred, as the CEO of an incubator, what's your take on the findings of that IRPs are not able to ensure that their companies are successful in attracting investor funding? Okay, the majority of IRPs. And are you seeing the same trends and challenges with within Vilgro that the startups we work with are not really ending up attracting funding? And also, but just start a little bit about Vilgro Africa and what it does.
Thanks, Ken. This is a brilliant panel, and thanks to the esteemed panel and also OCA for wonderful report there. I think it's Peter Drucker who said that if you can't measure it, then you can't manage it. So I think we began with measuring, and now we'll be able to manage this kind of how to attract more investments into the sector. View Africa, as alluded to earlier, is an early stage business incubator. But what sets us apart is that not only do we incubate, but we also invest. That means it's in our best interest that the investments we make will be able to exit. And the only way we can exit is when those startups raise follow-on capital. For example, Naum Monari here on the call is a founder of Benacare. We have stakes in Benacare. So every day we want to help Benacare to raise. And they recently raised, I think, $1.5 million from borrowing a few months ago. And they're on that journey because then, only then will we be able to get our exits. So I think the problem we are addressing today is the problem of misaligned incentives for IRPs. So most of IRPs, as the report alluded to, don't have a KPI around funding raised because it's not incentivized for them, right? If a donor gives you a funding and all they want is a report on maybe lives touched and they don't care about funding raised, then you'll not even be measuring it. And that's why you find even most IRPs don't even measure, most incubators, accelerators don't even, as the report said, only, I don't know what was the number, but a large percentage doesn't know how much funding the portfolio is raising because they are not tracking it. It's not in their incentive. So I think what we can change, especially with donors, is making it an incentive to actually track funding raised. This is not only a healthcare incubator problem, because last week, funny enough, this topic came up during the AfriLabs annual gathering, where over 700 incubators gathered in Cape Town, and these are across multiple sectors. And this topic came up again, like investors were asking, why are we not getting pipeline from incubators? Actually, it was the other way, that there were investors in the room who said that I want to invest in the pipeline coming from incubators, but I've not done any deal from the incubators. So the question is why? And the question was up to this misalignment of incentives, that incubators are not incentivized to get startups investor ready, connect them with investors like Jaza Rift and others. So if you don't have that in your strategy, in your model, in your operational model, then you find that it'll drop through the cracks. That's what will happen, right? So I think changing that and making sure, and what donors can do is, in addition to reporting lives touched, maybe make it a priority, which GCC does very well. I think GCC, when we first interacted, was using the term leverage of the money we deployed. How much have we leveraged from private sector and other sources? So if other donors also give this leverage as a KPI when they give money to incubators, then slowly we'll start to be able to track and report. You'll be surprised that even by reporting alone, we would end up with better number than what we have. The numbers were presented in this report, most of them were because there is missing data on funding raise. So imagine if all of them were reporting, then we would end up with a bigger number. It will paint a better picture for the ecosystem, which would then attract more investors. But back to the earlier point I made, that if you can't measure it, then you can't manage it. So let's all get into, and View Africa is happy to support other incubators. That's why we are part of Pollinate Impact, we are part of AfriLabs, we are part of all these other ecosystem associations, and we are happy to share our tracking metrics, our M&D metrics, or M&D tools that will help incubators to consistently track funding raised and be incentivized to actually help startups to raise. The other thing is we can also turn it into a revenue model. View Africa is actually paid to do transaction advice, pre and post. Some funders come to us to help them do due diligence and do pre-investment support, and they pay up to $40,000 or thereabout. And they also do post-investment. They also fund us to help them do post-investment support after they've invested, because we have the deep sector expertise in healthcare, which helps us to be able to do that very well. So that also ties to the point that the report made, that sector-specific incubators, be it in health or any other sector, are able to go that last mile, are able to go that extra mile, be it navigating regulatory, securing partnerships with governments and ministries, securing partnerships with other large players. So if you have a deep expertise, you're able to go that extra mile. And that's why even our partnership with JAZA and the rest of the Vilgro team, you find that there's deep technical expertise. We have biomedical engineers, we have bioscientists like my colleague, Dr. Robert. So we are very intentional in having, we actually have 2 PhDs in our team, all in healthcare, so that we can do that extra work of supporting healthcare startups. I can go on and on this, so I'll pause there. And
Thank you. Clearly, Vilgro has a lot of expertise and experience and successes in attracting investors. So we'll come back to you. I'll move on to Maji Sok, who is based in Senegal, and it's a unique area because one of the findings of the report is that there are not very many IRPs in Francophone countries or in West Africa in general. And so perhaps Maji later on will shed on. But Maji, as a venture studio, and I'm not sure if you have any health startups among the companies you started, could you comment on the findings that implies that the same question I had asked Wilfred, that IRPs are not able to attract investors, and particularly in West Africa or Francophone West Africa? And but start by telling us a little bit about Ask Ventures, or what you do as a venture studio. Maji?
Yes, thank you. Wonderful. Thanks, Ken. Thanks, everyone. It's great to be on this call this afternoon. So Ask Ventures, we actually started with the idea that we were going to launch a fund. And then we engaged the ecosystem around us, specifically in Senegal, to try and better understand the market. And the feedback that came up consistently was that there is already capital and the problem is pipeline. So something that's not new to any of us. And that's why we actually started a studio, because it allows to be more intentional in creating startups from scratch. So these startups are created from within, based on an idea, and with teams that are housed within the studio, and that work with us on a full-time basis and could graduate with these ventures once they become, we've proven a model and are ready to take it to the next phase. We currently have a portfolio of 12 companies, and indeed, as part of those 12 companies, 3 are in the health space. But important to say that we didn't immediately have startups in the health space. Initially, we're in logistics, agriculture, and a few others. When we were ready to engage in the health space, we quickly realized we couldn't do it like we do the other startups, and it required that we identify a partner. And this is how we have a dedicated health venture studio called Haske Health Plus, which, as you said, is in partnership with Institut Pasteur de Dakar, which is our national health institute, if you will, because they have the expertise. So to your question specifically on the investment side and why it's difficult to raise capital, a few from our experiences with these 3 startups in this space. One, it's a very technical sector. It's not one that you just, decide to jump in. There are a number of hurdles, a number of expertise that's needed. I think Vilgro was mentioning that. For us, we didn't want to have it in-house, so we partnered with the Institut Pasteur, and at the same time, they had made some pretty incredible discoveries during COVID that they also learned about how do you take to market ideas in the health space, and we could help fill that gap. And so in addition to the technical aspect, there's investors hesitate because they do want to more secure investment opportunities. And I think maybe more in Francophone Africa, the legal and regulatory environment is not so easy to navigate, so it can be quite intimidating. I think that's another hurdle that we do have to work through. Another one we're finding out is ventures that you're starting in the health space, particularly in some markets like ours, require a lot of education for your customers, clients. And some consider that maybe that needs to be done by government or an NGO and not necessarily by the private entity. It's a lot. We're seeing that in the microinsurance space. We're seeing that in the nutrition space for products that are definitely in the health sector, but you have to educate the market, and that requires some funding. And finally, for me, another area we're experiencing now is VCs who invest, also oftentimes concerned about the shareholding that an actor like the studio has in a venture. If oftentimes they believe it's too much. And recently we had to turn down an investment because the expectation was that we would reduce our shares by an amount that we just could not justify. And we don't always speak the same language. VCs have a particular lens they engage with. And that was a huge learning for us as well, that you have to think about different mechanisms to fund some of these ventures. I'll stop there. Like Vilgro, that's probably too much to share. I'll stop there for now.
Okay, thanks, Maggie. And just the panel, the audience, if you have any questions for Maggie, Wilfred, or Steve, just put them in the chat or the Q&A, and we will just get to them towards the end. But let me turn to Naum, who has really walked this journey as an entrepreneur who has gone through investment readiness program. You've also been successful in raising capital, as Wilfred, I think, mentioned it was what, $1 million+ from Boringa. How do these findings resonate with your own journey, i.e., most investment readiness programs really do not enable innovators to attract investment funding. But perhaps you can start by telling us about Benacare.
Thank you so much. I've been listening in, and I even wanted to jump in and say, no, let me tell you what I know about that finding. My name is Nau Munari. I'm the founder of Benacare, which is a social enterprise in Kenya. And what we're doing is we are reducing healthcare costs for chronically ill patients and their families by several programs that we have been having. So before I jump into my immediate reaction to the findings, I would like to just let you know about the journey and how it has been since the founding of Benacare in 2017, where I was a student nurse without prior experience raising or having a startup, or even education on running a business or even raising capital. So for the first 3 years, it was really walking in the dark. And not exactly understanding how to actually raise and support the business to grow. I got into the first Investor Readiness Program at Vilgro Africa in 2021. And I like Vilgro because they invested in me first before they started the Investment Readiness Program. We were not investment ready. And when I look back to how they could have actually invested in us, I believe that they actually are early stage IRPs. And when you will ask that question, and I hope you ask, I think my recommendation in the end would be we need early stage IRPs that are focused on people that actually don't even have business model laid out and financial models and everything. So the journey before we got on IRPs and after is, before we had raised 10,000 USD, and according to me, that was like a miracle, and it was so huge raising that kind of amount. But 3 years after, we have gone through the Investment Readiness Program. We have raised well over 1.7 million USD. So I would like to go back on my immediate reaction to the report that the IRPs do not ensure that their innovators raise. I think the ones that we have gone through have ensured. Maybe you should record this because you have not measured this, so you should. But I also believe that what they did differently was after the program support. After program support, I believe was very important, because during the program, there's a lot to learn. And sometimes we actually don't think this can happen. The action starts after the program. That is when you start putting the findings or the learnings to use. And then you start actually getting investors, interested and all that. And so the after support, after program support has been very strong. The check-ins, the support in refining the business models and everything. So I believe that has also contributed to us raising in 3 years, what I would call a record raising for someone who had not raised before or run a startup before. My other reaction to this is I noticed, and I agree, that there is very few health focused or related specific IRPs. And I think it's very important that we have more of them, because healthcare is a very unique sector where there's ethical considerations. There's the very complex regulatory landscape that is mostly a vacuum in Africa, where we don't understand where we start from when it comes to the innovations. So having a health specific IRP really makes a big difference, because I have been through investor readiness as well, for a general kind of investor readiness where we have agriculture, we have logistics, we have manufacturing, and then we have healthcare. We feel drowned inside it. We don't feel like we are addressing exactly what we are facing. So I think if we have sector specific IRPs, it has a bigger impact, because like Majdi said, we have experts who actually understand the unique challenges that we face, and then we can be able to navigate that. I'll stop there, just so we can go.
Okay, thanks. But just a quick follow-up, where you've talked about what IRPs can do. What can innovators do as an innovator? What do you think do you attribute to your role in the success?
Our role is following through with the learnings that we get, because they can give you the learnings, they can introduce you to investors, they can do that warm email, but if you do not come through and introduce yourself and represent yourself so well, and follow through with the due diligence and everything, nothing much can really happen. So the ball is always on our court. Once you have the learnings, it's on you to actually make it happen. And I think also for IRPs, once they realize that if they introduce you to an investor, you will do well and you will not let them down, they will always do the introductions to the investor. So I believe the role of the innovator is to follow through with the learnings, and always understand that the innovating space, there's no place where you can say you have reached. There's no bus stop. We are always learning and moving. So if we understand that and implement continuously, I believe that would be our biggest role.
Okay, thank you so much. And I'll just go back to you, Steve. And one of the findings, and perhaps I'm not sure if you mentioned it, is that women are not really well represented in either leading the IRPs or as innovators. I don't know, as Jaza Rift, or from your own perspective, do you have any thoughts on what can be done, or is that true?
I mean, it's a disaster, I was going to say, but I think some of us are trying to break that mold. A couple of preliminary finds. What we realize beyond healthcare is that, generally speaking, in many sectors in entrepreneurship, there's less women. Everybody knows that. Now, when you look at healthcare in particular, even though the primary healthcare providers tend to be women, they're well underrepresented in many of the programs, number one. Within the RPs, giving advice to entrepreneurs also, and Magic is probably the exceptions, but among the exceptions, like an organization that is, women-led and, providing those kind of support. What we believe that is that at this stage, there's a massive opportunity to develop products and services by women for women, but also generally for women. And so we've been really advocating for instance, developing a femtech venture studio, notably with one of the companies we invested in, Yeni Health in Ethiopia, where we can build an ecosystem where we have products and services for more women. And that means that we can also start segmenting, even within the healthcare IRPs, specific offerings that also would accelerate what we want to achieve, which is more innovations in healthcare going forward. And so one of the other elements is also supporting advisors, women advisors from the healthcare ecosystem to be engaged with existing RPs, especially in healthcare, to provide those solutions. And I'll give a very striking example. All of this week, we supported a biotech program with Vivro, and those bioscientists, PhDs, etc., set up companies, and I made sure every speaker that came, there was a man and a woman, right? And more balance. And it ended up having more women speaking to those entrepreneurs than men, so that there's more representation on that side. So it's really intentionality on driving more engagement with women entrepreneurs, including in healthcare.
Yeah, thanks, Steve, for that. Wilfred, I don't know if you, as Vilgro, have any comment on women and entrepreneurs and what role you play.
Yes, we do, and I see Naomi has raised her hand because women, we believe we are pro-women founders. My colleague Snyder has actually led a program for women-led only cohort, which we were able to raise $1 million from J&J, Boehringer, Sanofi, and other partners. And we began with a perception study supported by Oxford, which was looking at why are people not investing in women? And it boils down to perception. And my colleague Snyder can share that report later on, which you can circulate. But we found very interesting findings that helped us to tweak that program to address the needs of the program. And now we are seeing a lot of success. We already have commitments to do phase 2 of that next year, but I'll let Naomi speak to that. But before I do that, I would also want to say that the other thing that makes us different is our investment analysts or portfolio managers are in the trenches. They're in the trenches with the founders. I might sit here and take credit, but I think credit would go to our investment analysts. I see, for example, the analyst that works with Naomi, Amadi, even on Sundays, when there's a medical camp by Benakia on a Sunday, I'll see Amadi is sacrificing his Sunday to be there and support the medical camp. So we don't just sit in our desktops and give research and pontificate from here, but we roll our sleeves and we go down there and work alongside the founders. And that's what has made us been able to raise and help them raise the funding raise, including our M&E tracking, which my colleague Moses leads, which helps us to continually measure, are we moving the needle or not? We don't like to kid ourselves. We like to be very, and the data doesn't lie. So we like to be very empirical about it. Look at the data, see what we're doing, is it yielding results, and what can we change? But I'll let Naomi speak a bit about the Women Health Program and how we support women, and then we can go to the other.
Okay, now, please.
Yeah, thank you. No, I was raising my hand there because I just wanted to give a quick comment on, as a woman innovator, if, for example, I saw a call out for example, Investor Readiness Program, generally for any innovator, and then I saw another call that is saying, are you a woman? Are you running a healthcare business? Apply here. I would apply to the one calling me, are you a woman? Because I feel like I would have better chances at getting in than the general one. So we need to have those woman-focused also IRPs and readiness program and investment, because it actually speaks to us. Because I did speak to Snyder when she was beginning the program, and I remember us agreeing that as women, as African women innovators, our biggest challenge is not that the world does not want to fund women. Our biggest challenge has always been that we do not believe that we can get funded as our male counterparts. The problem is us. The problem is not the ecosystem. So once we solve that from within us, then we get the audacity to actually present what it is that we want to achieve in the next few years and even ask for the funding. And I'll just bring this up really quickly, that when I was fundraising with Boehringer Ingelheim, I was afraid to even ask for 500,000 for a very good project. I was like, I don't think they will give me this. But someone who was leading me in the process told me, no, you need to ask for $1 million. And honestly, I didn't think this would, happen, but they did give because the model is very good and it has a potential for impact. So I think for women focused, incubators and IRPs, what we need to speak about mostly is the perception in us that we cannot get this, or we are not good enough, we're not strong enough to raise as our male.
Okay, thanks. And Maggie, you are perhaps a pioneer also in this space, running a venture studio as a woman. And I don't know, can you comment on your journey and also how you support other women CEOs in the ventures you create?
Yeah, no, thanks. And I'm still reflecting quite a bit on this question, quite a bit. So if you look at our 3 health ventures, 2 of them are led by women, which is more than we in the overall studio. I think there's something around the ecosystem or value chain approach where, no offense to anyone, but I think women sometimes pick some of the most complex ventures or startups that require that you engage in policy. Obviously, there's the product or service you're building, the partnerships, and again, I was talking earlier about the education side. And women think, I feel, a lot about the greater good. So I'm not always scared to engage in these ventures that are very, very complex and require a lot of ecosystem or actor coordination. So I think when you come in as a venture studio, for example, where there's a lot of support in trying to engage throughout the value chain, and support a lot more than just the actual venture, it could be a little bit more encouraging or inviting for women to take it to the next level. So yeah, I love what has been shared in terms of it's something within us that needs to be addressed. But I also think to realize that women do take on some of the toughest challenges because they want to benefit the entire community. And that might require models that allow them to engage throughout.
Okay, thanks. And of course, I'll encourage those who want to learn more to reach out directly to Maggie. I hope you'll put your contacts in the chat so that they can learn your journey and also learn from you. But before we go to the audience, I just want to wrap up with my questions and then give to the audience. Is the role of government. So I'll start with you, so Steve. What do you see as the role of government in enabling these IRPs or the ecosystem in general?
I think that I wanted to come back to just one comment about what Naum said.
Okay.
We've noticed just something very quickly, that I actively engage with women entrepreneurs, and most often than time, I tell them, increase whatever amount you're asking by 30 to 40%. So it is something vivid, and I'll finish there. On what you said about the government, I mean, from our perspective, as an investor, we look at business models that are B2B, business to business, B2C, consumers, but we're very open to B2G, business to government, and B2D, business to donors or development partners. That's how we call them internally. So for us, government is both an enabler that we should make it more easy for healthcare entrepreneurs to act, and especially RRPs to figure out a model where RRP can be maybe certified or standardized to some extent so that there's consistency across them. But essentially, we see government as a partner because without government, in any case in healthcare, you are taking risk. They regulate you. They can now issue a national health insurance policy that enables more access to your business potentially. And so it's very important to understand how we can engage with the government to make your life easier and also not to make any mistake. And I know Nahoma has stories about regulatory approvals and things you can say because we've discussed that many times. I think it's our job as an investor to make sure that we give them the pathways with partnership like incubators and accelerators. And again, it's an enabling environment. Last point I would say is that also government should be part of the educator. You know, I was mentioning that we need to educate other investors about the healthcare opportunities, knowing that government budgets, they spend less than 5% of their budget to healthcare, and less than 4% of venture capital goes to healthcare, 70% being out of pocket expenses, right? Healthcare is fine, 70% is out of pocket. There's a massive opportunity also to raise awareness so that government can partner with us to achieve their own SDG objectives. So that's how we see government. Thank you.
Thank you. So I'll quickly jump into some audience questions and come back to the panelists also who can jump into this. Maggie, these are specific to you and venture studios. I don't know what advice can you share on venture building access to investment funding, and what is your experience in this? Perhaps you can also put the government answer in that. Maggie?
Sure, thank you. Yeah, I think the need for a lot of co-creation when we, both with the funds and with the government, to understand the model. I think there's a lot of education happening as to what a venture studio is actually and how it works. So building from the beginning together, I think is quite important. For the government, I think there's also something around public-private partnerships and how can we adapt them to the context we're in. A third element or advice I can share also is, at least in this part of the world, very little has been successful without integrating the informal sector. How do you, very, very sensitive to do that in the health sector, but we cannot shy away from it. How do you bring the informal sector in? Things we do need to consider both as part of the venture studios, as part of how we work with government and other actors. But yeah, so to me, a model we're seeing is we've been able to create ventures in the health space and other. For investors, a lot of education on what the model actually is. So maybe through collaborations, we've had commitments, our ventures have raised as well to be able to move to the next phase. And now we spend a lot of time with funds explaining that we're creating your future pipeline. How should we think about it? How do we want you to think about it? So we're co-creating.
Thanks, Maggie. And over to you, Wilfred. There's a question on what safety nets you offer to startups who are struggling to get investment funding, yet they are in your program. Is there any support you offer, safety nets? I don't know exactly.
Yeah, we do. And as Naomi began by saying that when she joined the program, she was nowhere near being investable, right? So we come really early, and at that point, we experiment with grants. We are lucky that we have blended financing, right? So we don't right away start talking equity with you and you don't even have a validated product. So we give you a grant which you can use to validate your business model, do a bit of early stage proof of concept. Then only after we've seen this as a business case, can we now invest? And then after we invest, we help you now raise follow-on funding. So our safety net is in twofold. One is we give you what we call concessional or grant flexible kind of funding. Then the other one is that we have the skin in the game, that no longer will you walk alone, we'll now be with you by your side as a shareholder. So as we are introducing you, you have the proof, you have the stamp of how would I put it? You have that stamp of approval that we've already invested in, and it makes it easier with other investors. Something we've experimented also, which also Majid is doing with IDRC, is also the research voucher, where we realize that startups also don't have the capacity to conduct research. So with IDRC, we're able to structure a research voucher program that takes the burden of research away from the innovator, pairs you up with a public research institute that researches on your behalf. We give them the funding. Then they give the startup the outcomes, the research outcomes, which even Naomi has benefited from. So those are some of the safety nets that help you to get that early validation, early traction before you go and meet the other return-seeking investors.
Okay, thanks, Wilfred. Now, just as an entrepreneur again, I know you talked about the role of the innovator in getting investment funding. Are there collaborative opportunities between startups or other organization, corporations, or investors that you would advise startups to join or participate in, and what has been your experience?
So my experience with collaboration and partnerships has been amazing because part of the reason I think we have done a lot with the little that we had was through collaboration, because then it helps, especially in the healthcare sector. I find that there's a lot of replication of efforts or ideas across board, which ends up wasting a lot of time and resources. So some of the collaborations we have done, for example, is with companies that are portfolio companies for Vilgro and other, Boehringer Ingelheim, other investors that we have had, and we utilize their infrastructure to deliver the solutions to our patients on a revenue share model, so that we do not have to also again build that infrastructure to provide the same services that they are actually providing. So I believe there's a lot that can be done cross-sector collaborations, starting with startups collaborating with other startups, because I believe that is where the meat is. Because when startups collaborate together, we can really do a lot. There's a lot of learnings, there's a lot of utilization of resources together, and then we achieve more impact and more results with it. But I also believe that the IRPs and the funding ecosystem should do a lot of collaboration with government. This one is untapped, but I believe it has a very, very big result. There's a project that we have done lately on dialysis, and we had a collaboration with government, and I'm telling you how fast things moved just because we had the government in it and, supporting the process, especially with regulation, especially with even stakeholder mapping. So I believe that IRPs and incubators and investors should collaborate with government, because as much as government has the bureaucracies and sometimes it's just not easy to work with them, having them by your side as you make decisions makes it easier for them to even approve, because they take credit. The other day we were saying the government takes credit, we take the money, which is perfect and very good. So they'll take the credits of whatever innovations that are coming in, and then as the incubator, you take the process, because then it's now becoming easier for your pipeline to actually gain traction and even introduce new models in the society. Because we have found, especially in healthcare, it's almost as if the regulators are behind time. So every time we come up with a new model, they are chasing after you to try and find out what they can write down. But if there's collaboration, before you even introduce the model, they know about it, and they're already even beginning to write down the structures for this model. The model that we're introducing for mobile dialysis, the regulators told us that they will use us as a benchmark for anyone else who might want to enter this sector, that we will give the policy to them so that they can document it. You see, now working with them that way makes it easier and the learning period shorter.
Thanks, Naum. And that's a very good feedback. And so, Steve, there's also a question, which is a general question about, is it worth investing both in IRPs that focus only on health, and are there any success stories? What is the percentage would you say for those investors who are on the call, should they really think about health?
Absolutely. I mean, I wouldn't be here if I don't believe it. So it's a yes. Now, how do you do it is the question. So I think we investors, what we hate is asymmetry of information, meaning even if we're looking at a company, the founder can tell us stories, we do DD, etc. The benefit of having an RP that has worked with the founder for an extended time, the program manager, the portfolio manager know them, they've seen them progress or regress, and they're very key to give us insight as to companies that we wouldn't get the wherewithal all the time to go deeper on. So a relationship with the Vigro and others enables us to break that information asymmetry and get to the next level and get to a decision much, much, much faster. So If you want to do a 6-month or 9-month due diligence, no problem. Partner with an RP that has the networks, the technical expertise, that has walked to walk with the founder for 6 months, 1 year, that has de-risked the investment for you, and then you can come in and partner with them to take the company to the next level. That's my really, really big recommendation. So there's a lot of opportunities in healthcare. And I just did a podcast this morning, and I showed that, look, you can get healthcare innovation at 30–40% net profit margins if you build the business well, if you invest in them well.
Okay.
Thank you.
Thanks, Steve. And I hope the panelists are also reading the questions in the chat, because some are specific. People want to follow up with you. But Lawrence, I don't know if you're still there. Let me just, there's a question on, somebody wanted to know, clarifying question on the nature of the startups in the report, and exactly the difference between the pure play accelerators and the venture studios. I don't know, Lawrence, any comment?
Yeah, I've already answered in the chat, I think. So we've looked at the IRPs more than the businesses that they support, right? So the businesses come from a range of sectors, and within health, they include biotech or medtech or medical devices or care delivery, the full range, the full spectrum. And so we don't have a breakdown information on which of those are bigger or smaller in the report. So that's my short answer to that question.
Thanks.
Thanks.
And Wilfred, back to the same question I asked Steve about the success percentage. How many, what would you say are successful within Vilgro or the general feeling on the landscape?
You mean successful
in raising funding and going on to survive? I don't know what you term as success.
Yeah.
Perhaps you can start with that definition.
So, we used to have, when we first got a USAID PACE grant, we had 3 categories. We had thriving, and then we had surviving, and then failing. So those were the 3 buckets. So you're either thriving, or you are either surviving, that is, you're just trying to keep the lights on, or you're failing. And we are, of course, if you're failing, we encourage you to fail fast. So in that metric, with that program we did with USAID PACE, we had put about, all our numbers were showing about 30% were thriving. You know, these were really taking off. They're raising follow-on capital. They're scaling across geographies. And then we had another 30% that was still struggling, and they are keeping the lights on, but they are surviving. And then 40% were failing. So failure rate is still high. So let no one lie to you. But then we count more on the ones that are thriving and succeeding, that those are the ones that will spur or catalyze the ecosystem. I need to check whether that number has changed. It's been a while since we tracked again those metrics. And maybe once we do that, we can get back with a number. But there needs to be a research across the ecosystem, not just a Vilgro portfolio. Yeah.
Okay. I know we are almost running short of time, but because we need to discuss a little bit about the next steps, which I'm not sure if but so at this stage, I know there are very many questions in the chat, but some are very specific to the panelists, so I hope the panelists can follow. But in closing, I don't know, let me start with Naum, just to give us an overview of your thoughts so far, the closing thoughts, and anything you want to say?
Yeah, related to this report, my closing thoughts would be there needs to be more IRPs that are healthcare related or healthcare specific, and to narrow it down also women specific, which will have a very big effect on the ecosystem and even on the impact metrics that we see. So I think this is something that can be done. And apart from making them more, just supporting the IRPs that exist more will ensure that more innovators are supported in the healthcare space, because again, healthcare space is very critical in our livelihood. So we need more support there so that we can do better in healthcare.
Thanks, Naum. And Maggie, perhaps for closing comments, and especially because Francophone West Africa is really short in these IRPs. I don't know if you have any closing comments and thoughts.
Yeah, I think a lot of synergies. I'm so glad that there was mention of the IDRC R&D grant. So thanks for that, Wilfred. I think we learned a lot from what's happening in Kenya in that space. Will Grow were received that initially. So continuing to share across the board, I think I will promote the venture studio model. I think it allows to be very intentional. I think it allows to have an ecosystem approach and bring the multiple actors that are needed around the table. And I think also it encourages to collaborate between different actors within the value chain and bringing the sectors together, insisting on the role of government as well. And there in Francophone Africa, I think it might even be more essential. We still have countries where government plays a huge, huge, huge role, more so than many parts of Africa even. So we just can't do anything without government. And this is one area where that's even more pronounced. And happy to engage to share more about our experience with others.
Thanks, and it's exciting to know about venture studios, and the audience can still follow up with Maggie with her experience. Over to you, Wilfred. Any closing comments?
Yeah. So for us, because when we started, we were the first ones and the only ones doing healthcare 10 years ago, and we know how lonely that journey was. Now, where we are today with more and more players, we want to start, as Will Grow Africa, we want to continue orchestrating that ecosystem because now we run the Health Tech Hub Africa in Kigali, which is a Pan-Africa Health Tech Accelerator. We are running it with JPIGO. We are doing other initiatives, and we are saying, can we now crowd in more investors? And in February, we will be launching a platform where we can pull together capital from different investors so that startups like Naum don't have to take a very long time to raise. Yeah, so be on the lookout at the SunCup next year in February in Nairobi. We're going to launch this funding platform aggregating mechanism where we pull in capital together. We've been sharing, I see people on the call that we've been sharing this idea with, including Path, JPIGO, and others, and you are all welcome to join. It's a community effort. I think we are better together as opposed to being siloed and doing our own thing, each of us. I think the more self-organized we are as a healthcare ecosystem, the more we'll be able to attract follow-on investment. People will see this as an investable asset class. So that will be my parting shot, and we are willing to collaborate. It's very good to see all of you on the call, and this was a well-attended call. To see so many people caring about healthcare investment is amazing. So this is really good, and let's take it a step further. Yeah, thank you.
Okay, parting shot, Steve, and then Mila will close.
A step further from incubation acceleration is investors. It's pretty simple. So please support the RIPs so I can get quality deal flow to invest in and take them to the next level. Thank you.
Thank you. And Mila, I know we are up to the last minute, but do you have any closing comments?
No, just we wanted to remind folks what our recommendations were, and I think it's been great to get so many of them validated through this conversation. Thank you so much to our esteemed panelists for your contributions here. I think we will continue the conversation and hope to attract more support for IRPs, for health areas, for women. I think it'll be important to explore what venture studio models could look like and how to scale those up. I think from a USAID perspective, when we talk about ecosystem initiatives, it's something that we're also excited about, particularly given our engagements with governments around the world, and funding capacity building as well for governments to reduce the barriers for IRPs to thrive. So thank you so much for everyone for engaging in the chat as well. We will figure out a way to share that back to you, as well as the recording, the report, and hope to engage further. And with that, have a wonderful rest of the week.
Thank you, everyone.
Thank you.
Bye.
Thank you.
Thank
Bye-bye.
you all. Bye-bye, everyone.